Good evening, Namah Shivaya. I have come here to introduce a new science which is now receiving a lot of acceptance in the medical field worldwide, and that is cosmic medicine. And whenever the science reaches to a place where there is a thick wall and you cannot move ahead, then the need comes for a new invention. And the modern medicine, a lot of good work has been done, but the modern medicine could achieve good results as far as acute diseases or acute problems were there. But as far as the chronic diseases are concerned, there was no breakthrough. It's only prolonging of the disease. I think I just started and she has to give, so I'm very sorry.
That's okay, Babaji.
Okay.
Okay.
Yes.
I want to take this opportunity and thank South University for inviting Dr. Shivynand to teach the modern medicine and the conventional medicine how to integrate the science of Shivyog. And Dr. Shivynand has been teaching globally across the world. He is on a mission to teach how to bring integrative medicine into the mainstream of the practicing the mainstream medicine. Integrative medicine is a new phase going on right now. The Shivyog integrative medicine and the cosmic science of integration is a completely different way of treating the modern stubborn diagnosis that we are facing in today's world. Let me give you a little introduction about Dr. Shivynand. He has been...
We can't hear you.
Need a mic?
Yeah. Nobody
Okay,
can.
I'll talk from here. Good idea. Dr. Shivynand has effortlessly traveled across almost 7 continents and all 30 countries that he has taught. He has been well received in the medical community to teach the science of Shivyog Cosmic Medicine, and he has been felicitated by Indian Embassy in USA just last week. He has been felicitated by the hospital in Boston, hospitals in Cincinnati, where the resident doctors and the practicing physicians have learned the science of integration of Shivyog. He has been felicitated also by Indian government that he is teaching the science of agriculture and how to use the cosmic medicine science, the regenerative science, the stem cell science, how to integrate that and make the incurable cure. Because there are so many limitations in modern medicine where incurable diagnosis cannot be cured. And the medical science will say, oh, you have this permanent condition, maybe it's arthritis, it can be a rheumatoid arthritis. In my practice of 37 years, what I have found, the Shivyog medicine, since I started practicing that in 2000, since 2000, I have never felt a dull moment in my life. I have never told anybody, oh, I was taught that the contracture cannot be treated, or the deformity of the rheumatoid arthritis cannot be treated, or the chemotherapy, the patients after the cancer should not do the exercise. There has been tremendous amount of success, not just for me as a therapist, but the patient have been empowered to have the Shivyog cosmic science, empowerment of the regenerative science, that you increase the healing capacity. Today, Babaji is going to teach us how to incorporate those breathing exercises, the power of breath, how to incorporate the vibrational frequency science that you can put in your daily practice. How do you use the energy of how you talk, how you touch the people. And it's just, still a conventional medicine. Whatever I have learned, I'm doing same thing, but I'm not changing the scope of practice. So today, all my therapist friends, what you are going to learn, that you are still going to practice what you have learned, but you are going to adjunct, you are going to add this therapy, and the sky is the limit, what you will achieve, and you will never send a patient saying, oh, I'm sorry, I can't help you. Okay. I also would like to felicitate Babaji before he starts teaching us today. I would like to invite Miss Rosemary, Miss Craig Rosemary. She is going to felicitate Babaji. She's with the plaque from City of Mayor. Steve Benjamin has sent the recognition and thank you to Babaji for teaching this science.
Thank you very much.
Yes.
I appreciate.
Also, the representative from the South Carolina representative, Mr. Smith, has sent a felicitation letter, and I would like to invite Sanket to hand that to Babaji. Okay.
Hello, I'm Rosemary Craig, and I love Columbia. I'm a strong advocate and an activist, and my life's been blessed. Had polio, paralyzed from my shoulders down when I was 4 years old. My parents were told I may never walk if I lived. My mother prayed. That's not considered science. All these many years later, after constant pain, a lot of suggested surgery, I was blessed to meet Dr. Dalal, who I believe is a student of our wonderful Dr. Shivynand. So it's my pleasure today to read briefly a letter to you from the House of Representatives of the great state of South Carolina, James Emerson Smith, our future senator. Dear Dr. Shivynand, please accept our sincere welcome to Columbia. We hope you enjoy your visit to the city and the state, and we proudly call it home. Along with many others, the people of South Carolina share an appreciation of good medical care and a desire to explore every possibility to advance its effectiveness. Illness impacts everyone, and everyone deserves the best available treatment. Amazing strides have been made in the fight against disease, but we must be open-minded and continue to work together to prevent people from experiencing the hardship and tragedy brought on by mental, physical ailments prevalent in the world today. Thank you for sharing your approach to a better and more compassionate medical experience for both the providers and the patients.
Thank you.
Thank you.
Thank you very much. I am a yogi from India, from Himalayas, so I know very little of the protocol and all that. I'm very sorry because I was told to address, and let me tell you one thing. When we Shiv Yogis, we start talking, we start emitting the cosmic medicine. It's an inbuilt phenomena. So if many of you feel a healing has happened, please don't be surprised. It's a natural phenomena because the medicine is very important. The medicine is needed if a person is sick. So one is the physical medicine, and what I am going to talk about is the cosmic medicine, the Shivyog Cosmic Medicine. In fact, in ancient India, the knowledge, wisdom, and empowerment of curing every disease and increasing the organic agricultural production was very well practiced. And now, when we were very happy as a normal citizen, I was very happy that medical science is advancing. There are so many new branches are coming up. So people are going to be very healthy. People are healthy, but the incurable diseases are not cured. There is only a symptomatic relief. And when the patient, how the patient must be feeling when they go to the doctor. And the doctor says, the disease is not curable. So there was a need to find the answer. And the answer was, raise the modern medicine consciousness to the Shivyog Cosmic Medicine. And when we started integrating, I don't know whether integration word is appropriate or not, because integration means I bring something and I add on to something. But Shivyog Cosmic Medicine is the understanding of the modern medicine at the higher perspective. And the moment we understand, we found that cure is possible. And in fact, the doctors, those who have now added or learned more of the modern medicine in perspective of the cosmic medicine, they all are very happy, because in many continents, the doctors, those who are practicing modern medicine along with cosmic medicine, they are reaching to one conclusion: the cure is possible. I had the privilege to train the medical doctors. Very recently, I am coming from New Jersey, and there I raised the level of their consciousness. Because let me tell you, all of us must understand that what we think as a physical entity we are, the physical body we are, just a tip of the iceberg. All of you, all of you. What you feel, what you are, is just not even the tip of the iceberg. You are much more. You have, everyone has the infinite healing potential which is lying in the dormant form. At the same time, you have the power to heal a patient no matter at whatever condition that person is. I was told that how can you say the disease which is incurable can be cured? How can you say the cancer patient who is at a stage where the cure is not possible, how can you say so convincingly? I said, I will talk later on about the cosmic level, the higher consciousness level. Let me talk at the logical level. Did the patient who is suffering from a disease, did he order the disease from Amazon? Or he went to a mall or outlet mall to pick up a nice disease? He created it. He created the disease. So if a person has the capability, the power, the wisdom, the knowledge of creating an incurable disease, does it have the power to reverse the process or not? I'm asking you. Please tell me. Yes or no? Yes. I remember I was in USA because the cosmic medicine, a lot of clinical trials. We were not knowing the modalities, how the trials are to be conducted. So wherever the people used to come to awaken their healing powers and cure themselves in India, there used to be gathering of thousands of people. So there were big agencies. They thought of doing the clinical trial. That people are saying, we are cured, but let us see. And the clinical tests were done. And the report was that from abnormal conditions, different various abnormal conditions, let it be thyroid, let it be any disease, from abnormal, within 6 days, the condition was becoming near normal. And they said, how is it possible, even if we give the medicine, how is it possible that the medicine cannot bring that result and you're not giving any medicine? I said, who told you I'm not giving medicine? I'm giving cosmic medicine. So please remember that. So this is what? The thing is, it is not visible, but it is visible. So that 5 years data we have collected, and if you want to see and study that, you can log on to our Shivyog website. Does it have? Cure is, yes, so it is there. So you can log on and see that. Then after that, now I'm again saying, the ancient time, the Shiva yogis, they used to heal people. The earlier time, there was no hospital, there was no nothing, and the patient was taken to a Shiva yogi, and just mere in his presence, the patients used to recover. So it's not a magic. It's not a religion. It's a science. And this is the science. It's high time. The medical profession must learn it. And then when I was in New Jersey, so they said, we want to experience, the tests were done, we want to experience here also. I said, no, the clinical trials is not possible. What I'll do is, I'll request you to bring the patients of your choice and bring the ultrasound machine. So let it be like the screen is here, and so there were the patients of tumor, the patients of cyst, the patient of stone, the gallbladder, or whatever stone was there. And I said, okay, let us start now. I was the patient, the area was created, the ultrasound quite away from me, and I was sitting on that side. And everybody observed, there were around 700-800 people in front of them. On the screen, the smaller cyst after 15 minutes disappeared. And the bigger stone became half the size. The tumor started shrinking. There was a case where the kidney, there was a peculiar tumor in the kidney, and the kidney had shifted like this. But within half an hour, the tumor size shrunk to half, and the kidney also came back. They say, how is it possible? And there was a lady who had a stone, and the stone disappeared. She came to me, she was feeling great, and she felt very nice, and she told me, you have performed a miracle. I said, what is the miracle? She said, without surgery, you have removed the stone. I said, if I am a miracle man, you are a miracle woman. She said, how? I said, if without surgery, you can put a stone inside. With the same process, without surgery, I can remove the stone. Is it logic or not? Because I'm going to talk a lot of logic. So first we should satisfy our logic. Then I'm going to talk about the cosmic medicine. So that is what it is. Now, how it happens, the medical science has to go further into the medical schools. What has to be taught is that every individual, the understanding or learning of the human body or anatomy, physiology is through dissection. We cut open the dead body and say, these are the organs, these are the organs, and that's it. But my question is, a dead body, the way the dead body behaves, is it in the same manner a living human being is going to behave? You can answer me. No, certainly not. Every individual has a endocrine system who is going to work differently, as a heart, circulatory system, digestive system, everything is different. So first of all, our learning and understanding is on a living human being. Now we treat the person as a specialized person, but let me tell you, we will have to understand that every human being is not a single individual. Every human being is a community of 55 trillion cells. And the cells are not the just dead beings, they are living beings. And every cell has the mind of its own. Every cell has the mind of its own. That means 55 trillion minds are working within this body, and there is a super mind, the supercomputer is working and controlling those 55 trillion cells. Those who are going to study the stem cell, I'm giving you the clue. So now the science says that what is the capacity of this computer, this living cell? Every cell has the memory of its own. Believe me or not, because in Shivyog Cosmic Medicine, we are going to talk a lot about the intracellular memory. So every cell has the memory of 8 GB. That means a computer, we agree, we don't want to dispute, but the memory is much more than 8 GB. Now that 55 trillion computers are working within your body, and your mind is a supercomputer. Now this building of pharmacy, if we make it 10-story building, and we want to create a computer equivalent to the human mind of any individual, we need the 10-story building to install that computer. So first of all, we must understand what we are. And another thing is that every human being is using only 4% potential of his total mind power. He has no access to 96% potential. And when I teach the Shivyog Cosmic Medicine, and when they have access to that cosmic energy, they find, yes, the cure is possible. And another thing which is there in every cell, the DNA, only 3% DNA is active. Am I right or wrong? Please tell me. That means 97% DNA are not active. And the studies were done that if the DNA activation happens, and if they go up to 10%, even the body's cellular system has the capacity to neutralize the AIDS virus. So it is your body consciousness which is lying in the dormant form. Now, when I was teaching the doctors, I asked them a question that you have, because the most brilliant student, they choose the profession. The most dedicated and most brilliant students, they choose the medical profession. After 7 years of studies, when you see a patient, how do you decide whether the disease is curable or not curable? How do you decide? Availability of medicine, yes or no? Am I right? If the medicine is available, I say the disease is curable. If medicine is not available, I say disease is not curable. That means that 7 years of good education must be utilized. And a person who is sick, what are the resources available to cure a patient? One is the medicine, yes or no? Another resource is a doctor. Another resource is a doctor. And third resource is a patient. But we are only depending upon the one resource, that is the medicine. And the Shivyog Cosmic Medicine curriculum is to make the doctor as a living medicine. Make the doctor as a living medicine. I'll tell you how later on, and if I forget, you can ask me the question, because as I said, I am a yogi. I do not know how to make slides, so if the slides are there, I can connect and I can tell you word by word, but I'm just looking at you, and whatever your questions are coming, accordingly I am speaking to all of you. Now I will be explaining to you how a person can become a living medicine. As I just said, purposely I said, that in the ancient time, when somebody was not well, he is the mere presence of a Shiv yogi. He used to experience the feeling of well-being. So how they were experiencing, it is through that medicine. The person was a living medicine. Now, what are those medicinal factors which are there? Now, human being, we must consider, is not a single individual, but he is a community of 55 trillion cells. And every human being is not only a physical entity, but every human being has 5 bodies. All of you sitting here, all of you, when I teach them how to become a living medicine, then I make you experience your etheric body. And this time, the modern science has agreed, and they talk about aura. The Russians, they developed the Krillian photography, and now in USA, the PIF photography. That means you have an etheric body. So my teachings are only up to etheric body. Then when the doctors are ready, then I will teach them how to perform more medical miracles. Now, the physical body and etheric body, they have a resemblance. Like the physical body, how healthy the physical body is, same way your etheric body will be that healthy. Now, if a person has a disease in the heart, that disease you will find in the heart of etheric body. If a person is suffering from a tumor, then the same tumor you will be able to find that exists in the etheric body. And another thing of the Shivyog Cosmic Medicine principles is that the disease never come directly into the physical body. Never directly. It starts from the fourth body, and then it manifests into an energy body in the etheric body. So if there is a tumor in the physical body, that tumor is going to exist in the etheric body. If there is a blockage in the heart, in the physical body, the same blockage will be present in the etheric body. Today, I was in a clinic, I was in the Vital Energy, and there was a small baby of 2.5 years, was brought to me. She had a tumor in the brain. And the surgery, when was, how many months back the surgery was? In December. How many months? 7 months back, the surgery was performed and the tumor was removed. So practically, when the surgery is performed, there should not be any tumor. But again, the reoccurrence of the tumor, very fast. It was there, and the mother was very worried, and I said, bring the child. Now, why, I would like you to understand why the reoccurrence of tumor happened. Because the surgery was done in the physical body, whereas the tumor in the etheric body was still existing. And that is the energy body, and from that energy body, it trickles down and come to the physical level. Because in our cosmic medicine, Shivyog Cosmic Medicine, I'm going to explain a little more functions of your nervous system, your central nervous system, your heart, your different organs, what are the other functions, and your cells, the other functions which we have been overlooking. And when I bring the attention, then the doctors, they say, oh, it is possible, we must work. The nervous system, only it is not what we understand. There is a lot more which we have to study. Now, when the surgery is done and the tumor remains, then after some time, it is going to, that energy will be passed on to the physical body exactly at the same place the tumor will reappear. The heart patient, if there is a valve, so the surgery has been done, but at the same time, after some time, you will find again the same problem has happened exactly in that part of the heart. Now the cancer is there, now the chemotherapy is done, the surgery has been done, but again, why the patient is been called for regular checkup every 6 months or 1 year? And if you ask the doctors, they'll say, to find out whether there is any residual effect. Now, what is residual? Is the disease is still existing in the etheric body. I was just asked about the organ transplantation. That what is your opinion about organ transplantation? Again, I will say, if it is at physical level, if the body, human body is only the physical body, it's very good. But it is not that. And even it is a physical body, there is a challenge. And the challenge is the cells have the mind of its own. And you are taking the organ of somebody else, and that organ is also made up of the cells of somebody else, and whatever that person emotionally was feeling, whatever psychic impression that donor had, all that is programmed in the intracellular memory of that organ, and whatever this person who is receiving the transplantation, his emotional level, his thinking level, his psychic experience level is stored in the intracellular memory of his body. So what is going to be the compatibility? And another thing is, can anybody tell that after the transplantation has taken place, it succeeded throughout the life, or it is only that? Now, another thing which is there, that in the etheric body, the old organ is still existing, and the new one you have brought in the physical level, whereas that has not gone to the etheric level, and that has not gone to the astral level, that has not gone to the causal level. So if you are like, it's like you take a tree sapling and you plant, and if the roots they catch, the tree is going to survive. But if you pluck an apple and implant, what is going to happen? This is a question I am asking to the doctors. I have the answer. Whenever you are ready, I am going to. So the best thing is, the human being has the power to regenerate. So best is to regenerate. And another thing which I just mentioned, that every human being is a field, is a electromagnetic field. This is what we must understand. The we run through electricity. We run through electricity. And which is the organ who is responsible for this bioelectricity? You will be surprised. It is your heart. It is your heart has a big, big electromagnetic field. And a person who is healthy, he has around 30 to 50 or 100 microvolt. I'm not very sure of that unit. That is the electricity which is running. And if the same person becomes a yogi through the ancient yogic practices, he can raise his electromagnetic field to 2000 to 3000 microvolts. Now what happens to a person who is sick? Certainly it will be less than 50. What happens to a person who is depressed? It will be 8 or 9 microvolts. What happens to a person who is alcoholic or takes drugs? It will be even much low. And that reveals the self-respect or self-confidence level is absolutely depleted. So what we'll have to do is we'll have to raise the electromagnetic field. Now we learn immunology. The body has the immune system, where the body has those phagocytes, and they are patrolling all over, and if there is some antigen or cancerous cells, when they appear, then the body self-defense mechanism neutralizes those cells. The phagocytic action is there. But if the body consciousness is very low, very, very low, then the efficiency of the defense mechanism, those T cells and phagocytes, it reduces considerably. And when they go low, it is the nice time for the cancerous cells to multiply. As a matter of fact, I was in Canada, and there was a report, very worried report, that now the cancerous cells are found in the human body. It might become an epidemic. I said, when the cancerous cells were not appearing in the human body, even right from the ancient time. All of you sitting here, many times those cancerous cells must have come up. But because of your defense mechanism, they were neutralized. It is when the body consciousness, when the energy level, it goes down, like earlier, now we have got a victory on tuberculosis. But 20 years back, the tuberculosis bacilli and the TB drugs, they said if the defense mechanism goes down, because those bacilli are still present in the lungs. E. coli in the gut microbiome, the amoebiasis, the entamoeba. So the body defense mechanism is not only the nutrition, the body defense mechanism is the energy, the vibration, the electromagnetic field. So if a doctor becomes a living medicine, when he goes to in the presence of a patient, is a non-verbal communication. Now, when I talk about integrative medicine, then what I do is I instead of giving allopathy, I say, okay, I give herbs. Instead of my medicine, I give some other therapies. I'm not talking about that. I'm talking about simple, plain medical science. We are awakening the consciousness of the same medical science. You don't have to give anything extra. What you have to do is awaken your knowledge, awaken your consciousness, and the moment a doctor who is practicing the cosmic medicine, his patient starts recovering. I always said that a doctor has to be very healthy. Do you agree with me or not? Healthy at the physical level, healthy at the mental level, healthy at the emotional level. Why? Because what he is giving is health. Like you go to the bank must have a lot of finances. Because you go to the bank for money, and you go to the doctor for health. But the statistics, they say that right during the study period, the students are very much stressed. Now, stressful condition, is it a health condition? Please tell me. What do you think? A doctor is supposed to be stressed. That's why I say the Shivyog protocol is rogi se nirogi. From sickness to healthy, and from healthy to the living medicine, a yoga. So this is the curriculum which I am introducing. And in fact, it is very, very important for every nation. Every country, the health of the people should be the foremost area of attention. And I'm appreciating the USA is really looking at it, because the message is the healthy people will only make the healthy nation, and sick people will make sick nation. So I have come to USA to contribute, and the wisdom of ancient Indian yogic tradition, which I want to teach to the doctors, to share with everybody, where they all must understand cure is possible. And when I was told that I am going to meet the doctors, the students, those who are working on, what is that called? Occupational therapy, I always tell the doctors that after you have performed the surgery or the hospitals where the cancer treatments are being done, you have done the chemotherapy, please do not leave the patient on his own. He must be now looked after very well, because that is the convalescence period. So there should be rehab centers or convalescence centers attached to the hospital. So after the patient, they come out, then these occupational therapists, they start working on the residual effect which is left in the etheric body. So a combination of the medical treatment and the occupational therapy is going to, certainly, I am very happy here that it is being taught here. It will bring good results, and our objective is health for everyone, to make the nation healthy. So thank you very much. Now, if you want to ask me any questions, then I will go on. Yes. See, we all emit the vibrations, we all emit the illumination, we all emit the energy. Like in every cell, the DNA, if the person is really awakened, becomes a living medicine, then his DNA emits the biophoton energy. Biophoton energy. And a patient whose body consciousness is very low, when the doctors emitting the biophoton energy and the patient's cell receptors, they receive it, then the body awakens, and once again the self-healing mechanism, it starts. Like the physical body is made up of the cells, the blood circulation, there is a nerves, the mesh of nerves all over the body, and the arteries and veins where the blood is circulating. Similarly, your etheric body has the energy meridians, where the cosmic energy continuously flow. And 10 years back, I had explained that. I had been explaining, and I came to know, I'm very happy, in the Harvard or some medical universities, the research was done on this etheric body, and they said there is a vibrational frequency, which we say that the etheric body emits the vibrations. Like when we used to bless our students, we say, Tejasvi Bhava, means vibrate at a higher cosmic frequency. Now, an individual who is very healthy, he vibrates at a frequency of 62.7 hertz resonance. That is the vibrational frequency. And if a person is suffering from flu or viral infection, his vibrational frequency will low down, and it will be less than 60, maybe 57 hertz resonance. And if it goes further down, less than 50 hertz resonance to 40 hertz resonance, the person suffers from cancer. So the cancer person vibrates at a much lower frequency. And below that, if it goes up to 25, then the doctor say, now you have 1 week or 1 month or 2 months, you're about to die. But there are another community of people where they vibrate at a much higher frequency than 62. They go up to 80, 100 hertz resonance. The medical science could measure those Shivyogis, 80 hertz resonance, and they said they are genius. Now that's the only thing they could say. But they are emitting the healing energy when they are vibrating at a much higher frequency. So through the Shivyog practices, the Shivyog is an ancient phenomena where the Shiva means the cosmic consciousness. And yoga, the literal meaning of yoga is merging with a higher consciousness and immersing yourself, your individual consciousness, raising your individual consciousness to cosmic consciousness. That is your natural phenomena. So working on the etheric body and the chakras which are there, we work on them. The God has really created, the nature has really created a very, very intelligent system, and it is high time now we have to rise above the body and work at a higher level. Now, very interesting thing is that every second, more than 3 million cells in every individual, they disintegrate. I'm not using the word dying, because dying means the thing separate from the soul. But I'm using the word disintegrate. Now, more than 3 million cells are disintegrating. And of course, then the new cells are taking birth. 3 million. That means the nature has provided us a system that suppose if due to ignorance we create a disease, the nature says, okay, we are disintegrating your cells, so now you bring in the new cells which are healthy, whole and complete. But that does not happen. If a person is suffering from any disease, and the people, they say this disease is there from last 5 years, 6 years, 1 year old. And let me tell you, every cell of the body disintegrate within less than 1 year time. So if I ask you, can you give me a cell of 2016? You'll say, sorry, I don't have. So the body is, at the same time, I don't have that data, but even your heart will disintegrate completely within few weeks' time, and the new heart will come, the liver, pancreas, even brain cells, even the spinal cord, even the bones, everything disintegrate, and after a couple of few weeks and few months, they regenerate. Now, why is it that the new cells which are regenerating, they are also the disease cells? So we'll have to understand, even in the modern medicine, we'll have to, expand the chapter on cellular biology. In the modern medicine, we'll have to expand the chapters of the nervous system, the neuroplasticity. There was a gentleman who got the paralysis, and he was a very confident person. Now, there are two types of people. One is the paralysis is there, doctor, now this is my body, and my body is your business. Please, you take care of it. But who created the paralysis? That time, I handle my body as my business. And when the disease comes, So I said the third factor is the person, the patient, because the patient has inbuilt healing phenomena. There is a pharmaceutical factory which is present within the body and it is on lockout. No medicine has been produced. Now, I hope there may be some pharmacy students. I'll request you to please study the British Pharmacopoeia, American Pharmacopoeia, and study the formulations and see the resemblance of many of those chemical derivatives. Are they being secreted by the body or not? Now the Valium, now a lot of psychotherapists, they must be using Valium. So Valium, if a person is using it for anxiety, after some time he'll become a zombie, useless. But your pineal gland, when you go in deep level of sadhana, turiya avastha, you secrete Valium from inside. And that Valium which you secrete from inside is a biomolecule. The chemical molecule has side effects, the biomolecule has no effect. And you become more clairvoyant, your intuitive powers increases, your healing powers, your physical powers, and you experience the deep level of tranquility. At the same time, you become very alert and your focus becomes better. So, behind all this pharmacopoeia, I think there must have been a yogi. And those yogis, they studied clairvoyantly the human body behavior, and now we are forgetting that work. So, the cellular consciousness, now the modern medicine is agreeing that the new cells which are regenerating, they are guided. It is not the DNA phenomena which is responsible. It is not the genetic phenomena. Now, it's a crazy statement I am making, but I'll request you to please study that. It's not the genetic phenomena, it is not the DNA phenomena which decides that the healthy cell has to regenerate or a diseased cell has to regenerate. The DNA is the blueprint, and blueprint cannot be a builder. So there is signals coming to the cells. Who is sending these signals? There are multiple signals. They come from higher consciousness. Now I come to the cells. Now what happens to the cells? When they disintegrate, I never use the word cells die. Cells disintegrate and they are converted into atoms, molecules and atoms, and they are alive. They are not dead. So there is a need to now study and create the molecular biology, if we have to really understand, the atomic biology. And if we have to really work on the cancer patients, then the subatomic particles, electron, proton, neutrons, because they are vibrating and moving. And why the cells, they behave differently in different individuals, and the atomic configuration decides, one aspect is, decides whether that atomic configuration should create a healthy cell or a diseased cell. So there is something which is very deep rooted. The science to be learned is the Shivyog Cosmic Medicine, because it is that cosmic consciousness which is controlling the behavior and guiding of subatomic particles. And if we understand and we know it, we can really do much better. Thank you. Yes.
Namah Shivaya, Babaji.
I couldn't hear what she said. Please, have you turned the microphone?
Yes, I believe it's on.
Good.
I wanted to ask you if you could talk about autoimmune diseases and why they occur and what can be done to cure them.
It's very simple. Your cells, you have the cellular mind, 55 trillion cells. And who is controlling the cellular mind is your mind. Is your mind. And your cells, they are very, very obedient. Very obedient. If you are happy, it's a communication. Now you have to learn to decode your language. It's very important. Every human being must learn that. If you're very happy, indirectly you are sending a message to the cells, oh, I'm very happy on this planet Earth, let's live. So they're very happy. Now some incident happened where you're very sad. And many times, many people, they said, I don't want to live. In the agony, I'll request you, please don't do that, because you may be thinking you are an individual saying, I don't want to live, but you are confusing 55 trillion people inside. And they listen to you. And the moment you say, don't want to live, they say, okay, let's wind up. They start winding up. And then you say, no, I want to live. Okay, come on, live. And then say, I don't want to live. Then what happens is there is a confusion. And some cells, they are confused and they start thinking the other cells are their enemies and they start attacking on each other. That is the autoimmune disorder. And it can be cured very easily. At the etheric level, at the mental level, at the cellular level, you'll have to work and you'll have to bring in that cosmic energy. Because, see, all that negative information, whatever you are thinking, it is programmed in your cells. And that programming is not the language, but it is the energy programming. Like you are using the cell phone. So how the cell phone voice is coming to you? That somebody is listening, oh, hello, how are you? No, it is a vibration. It's a silent communication. It's a non-verbal communication. Now it's very easy for me to teach the doctors that there is a non-verbal communication, not always the verbal communication. And you are used to it. Like when you are switching on the cell phone and you are talking to somebody, it is a non-verbal, it is a vibration, and the cell is further decoding that into a sound, or in the laptop, even in the pictures which are there. That technology, that is artificial consciousness, we are working, and we are forgetting about our cosmic consciousness, which we must, it's high time, if we are working more on the artificial consciousness of the machines, and we do not work on our awakening of cosmic consciousness, then the problem will be there. So we are communicating to these cells. So now when we are thinking, whenever the wrong emotions are there, whenever sad emotions are there, we emit that language into vibrations, into energy, and that has been stored in your chakras and into the petals of the chakras. It is stored in your higher bodies. So you will have to release that, what you at one time had communicated by way of traumatic incidents. every time when a person experiences a traumatic incident, he emits the energy and it has been programmed inside. Now people may say, I have forgotten. You have forgotten, but the abscess formation is happened. That energy is still there within you. You need to release that. And when you release it, you are cured.
I've got a question that if a person is, the patient is emitting a very positive energy and healing very fast, but if his friends visit quite often and they don't want you to get well soon and they want you to die or something else, so will their negative thoughts will reduce your pace or rate of recovery because somebody else without talking to you is emitting very negative energy and that's a powerful person?
It's a very natural phenomenon. Now why I want to train the doctors to become a living medicine? Because it has been, the studies shows that the doctor who is specialized in a particular disease, later on they develop the same disease. It is because your etheric body connects to the etheric body of the patient. And whatever that patient disease is, the etheric debris is left on the etheric body of the doctor. And if it goes on and on and on, then it might manifest into a physical ailment. Now, another thing is that the law of physics, the energy from a higher level, it flows to the lower level. Now, the patient who is coming to the doctor is certainly suffering from lower energy, and the doctor is having higher energy. So every time when you see the patients, they are receiving the energy from you. That's what in the medical seminar of Cure is Possible, I taught them the etheric diagnosis. We don't need a CT scan machine. We use our human consciousness. So I asked them what happens to their energy field. So that means that whatever your energy field is there and whatever the patient energy field is there, they are going to resonate. Now, if your energy field is very high, you are going to bring up the energy field of your patient, and his body consciousness will awaken and he will start healing much faster. Now, similarly, the people, those who are coming to you and they are talking negatively, now you have to see how much is your energy field. If you raise your energy field to a very high level, then the person who is thinking that, okay, I'm going to that person and I'm going to download all the negative garbage on him, but your energy field is going to raise the energy field of that other person who was thinking that he will talk negatively to you, but actually your thoughts are controlled by your cosmic energy. And when you raise the cosmic energy of that person, he will be very sad. He will not be able to talk negative to you. So you don't have to become vulnerable. खुदी को कर बुलंद इतना कि खुदा बंदे से पूछे बता तेरी रज़ा क्या है. That's what is the answer. You will see so many different type of people, but what you choose to become, stick to that.
Thank you.
Please switch on the mic.
I have a question, Namah Shivaya. If that is the case, then how, like you gave us example of a 2.5-month-old baby with a tumor. Now, he has not thought about any bad things or done bad things, So how babies get tumors and all these problems when they are so innocent. And in my field, I have seen young athletes coming, cheerful, joyful, young, playful, and on the field they have chest pain. They come and we find that they have cardiomyopathy. It means their heart is weak and this and that. So all these problems, they have not even thought about it.
That's what I'm saying, that don't treat or consider a human being as the physical entity. He has the emotional body, he has the etheric body, and now, very interestingly, as you just asked the first question about a baby, the mother was with her. I asked the mother, how was the pregnancy period? Were you nice with your husband? She said, yes, I was very nice. Anything else? She said, I was stressed. I was stressed. I said, what was the stress during pregnancy? She said, job. My job was stressful. I said, anything you can think of? She said, yes, my mother-in-law. And she had a lot of traumatic thoughts even now. So the mind-body relationship, you must, as a doctor, you must see that. So I asked her, okay, think of that stressful moment and where you felt the stress in your body. She said, I don't know. I said, no, think. Okay, you go to that incident and feel the stress. Your mother-in-law is bothering you, your office is bothering you, and you have so much of stress. Where you felt? She said, here. She said, here. I said, now tell me, where was the tumor touch the baby? Exactly at that point, she said. The tumor was here. She was feeling, so at the physical level, so generally the baby is connected with the mother through umbilical cord. And whatever emotion the mother is having, the same emotion is passed on to the fetus. And what she was feeling, she was creating a tumor. Now whatever negative energy, whatever the negative thoughts you are having, now they are passed on to the cellular system. Now some people might feel that the back is hurting. Some people, the stress, they will say, my stomach is hurting. Some people, they say, here I'm having migraine or whatever. So that was there. Now I said that you have brought your child for healing. I think first you need to be healed. Because the same what you were feeling during pregnancy, you are exactly feeling the same stressful condition and traumatic experiences. So I will work on the child, but I'll work on you. And then I release her trauma. And she felt so much of relax. And the little baby who was restless, she went off to the sleep. And now the process of further regenerating tumor was arrested today. Everything is psychosomatic. And the little babies, they have very open aura. I always say, during pregnancy, for God's sake, during pregnancy, if you want to have a wonderful child, then let the mother remain very, very happy. Pamper the mother. Offer the love. Look after her. And let there be a situation of happiness within the family, and you will find the child which will be born will be very healthy, very bright, and very successful. Thank you.
In in psychiatry, we have kind of a technique or treatment called transmagnetic, TMS. They say where they treat depression. So it changes the magnetic field in the brain. Is there something like this, a tip you can give, which can maybe do something similar for patients with depression? And
See,
sleep
when the
issues?
patient with depression they come, now try to look for a machine where you can measure their electromagnetic field. The bioelectricity, how much level that person is having, and raise that. The moment you will raise, and there are modalities in the Shivyog Cosmic Medicine, the moment you will raise, the same person will open his eyes. Like in the Shivyog seminars, invariably we have seen a good percentage of cases. The patients were suffering from depression from last so many years, and suddenly within 3-4 days, he just opened his eyes, like woken up, and the depression disappeared.
Something that you can recommend that I can give to the patients to practice? Simple technique that they can take home. I might see them every 3-6 months.
First of all, you will have to work on the patient. They need help.
Yeah.
And then teach these rehabilitation people. They work on that. And then after that, yes.
Any tip you can give?
Then after that, the patient is on his own to practice the meditations. But initially, there's a lot of blockages are there.
I mean, they do get a lot of therapy, counseling, medication, but is
counseling, I believe if you have to change the thought, change the energy. If a person is blocked, his thinking process will be in accordance to the energy level which he is storing in. So no matter how much you say, talk this or visualize this, or see you're walking on the seaside and seeing the trees and whatever, I don't know how much it is going to help. But you will have to work on the energy of that person. And the moment you change the energy, you raise their energy level, the person, thoughts will change.
How do we do that?
Babaji, can I ask? I think what in my experience, what you have taught is this power of breath.
That's one area. That's a little area. This is not much. It's the bring in that cosmic energy and open his energy centers. It works. Yes. I'm not very sure how much time.
We have a time till 8. So maybe if they can practice the breathing exercise with you, Babaji.
Well, it is one of the area. Yes, why not?
Yeah.
Yes.
Good. Does everybody wants that?
Yes. Any other?
Hello, Namaste. I have a question. We talk about the cure is possible. To my understanding, it looks like only the disease which already have a treatment, medicine and treatment, those are the only disease on the cure list.
The cure is possible, even relationship can be cured.
No, I'm not talking about relation. The disease which does not have a treatment yet or medicine yet.
That's what I'm saying. Cure is possible. Whether the medicine has been introduced or not, the disease has been introduced, no? So if a person has introduced a unique disease where the medicine is not there, awaken his body consciousness, and the doctor become a living medicine, and with the modality of Shivyog Cosmic Medicine, cure is possible.
have a question. Do you believe in someone using medicine to treat themselves in addition to the Shivyog Integrative Medicine?
Yes, the medicine, we are doing the same, exactly, the doctor will do the same thing, but the energy, the vibrations physically are not seen. Like I'll give you an example. A doctor who is specialized in the cancer specialist, when she did the program, then when she went for the anesthesia, the dose reduced to half. So we are giving the medicine, we are not replacing. Again I am saying, I am not replacing. I am raising the modern medicine to the cosmic medicine. So you will be giving medicine, you will be performing surgery, but this time you will find the surgery is successful. Apart from the hygiene, we work on the etheric hygiene, because the patients, they suffer, they release a lot of etheric debris. The ICU, the doctors, they tested. There are so much of etheric debris in the ICUs, in the operation theaters, in the OPDs, in whatever the clinics you have. So that has to be released every day. So that is what we are teaching to the doctors. You will have to use the medicine, but so thank you very much. Thank you. It was wonderful, and I'm very happy interacting with you. You can do a lot good to the people and provide them good health and happiness. Namaskar, and thank you. Yes.
Okay, I have a question. As far as practicing on daily basis, are there any specific techniques that we can do at home in order to better ourselves as far as healing from the inside ourselves? As far as, I mean, as breathing techniques, but is there any specific guideline meditation that we should follow? So if we feel like we're not like misled when we're doing it ourselves. Because every time I try to practice myself at home, I'm always questioning to myself whether am I doing this correctly or am I, what techniques do I need to follow?
Well, I'm traveling in US, and now I'm going to Orlando. So there I'm going to empower the doctor or the people to do the self-healing. So breathing is one aspect of the Shivyog Cosmic Medicine as a totality. So you will have to come and learn.
Well, I came last year in Atlanta with Ishanji. We did the intensive training last year in Atlanta for 5 days.
Now, Ishanji training was to release the emotions which
yes,
you
sir.
have. But the healing part is...
Right, but even like after the 5 days, if I were to practice at home about just certain techniques that were being taught.
You should practice, and I always recommend that you must practice every day.
Yeah, but it's always, I feel like, if am I doing it correctly? Am I, like, is there like any specific thing that we should follow?
So that specific I'll teach.
Okay.
Yes.
Okay.
Thank you.
Thank you everyone for being here. Thank you Babaji for departing this valuable knowledge of integrating Shivyog into medical healthcare field. And what I would like to add today, what we learned is just the introduction that how it can be utilized in your conventional practice. It can be pharmacy, it can be medicine, it can be surgery, it can be therapy. But you are still going to practice what you have learned in your medical field, and then you are going to use this as an adjunct again to just change Use all your sensory powers. That's what Babaji is teaching in Shivyog Cosmic Medicine. All the sensory power of 24 senses, but usually we know only 5 senses, and that's what we are utilizing. Babaji is teaching us how to activate those 24 senses and then make functional use of it in your normal practice and make the cure possible. Thank you very much, Babaji, and thank you all of you. Thank you, South University, for hosting this. Thank you, Ms. Lindsay.